This is part 6 of 8 short videos in the Getting Started with Primescan 2 series. In this video, I demonstrate how to take a treatment scan with Primescan 2.
Now, let's look at what a treatment scan is. Barry needs a crown on tooth 26. If he agrees with the treatment, you can reuse the existing status scan, saving valuable time during the scanning process. By avoiding the need to rescan the upper and lower arches, and especially the buccal bow, you streamline your workflow and improve the overall patient experience.
Go to the treatment section and select New Treatment.
A window will prompt you to define the treatment type. In our case, choose restoration and select the relevant tooth number, which in this case is 26. We will select crown, then click Create Treatment. Next, click on Start Primescan 2 and select Use Status Scan. This is to keep the digital impression made in the status scan section and go faster by scanning only the areas we need. Since I'm using the existing status scan, I can fully concentrate on the preparation, paying close attention to the cervical margins, and ensuring all surfaces are clearly defined. I also make sure to capture the proximal areas and contact points accurately. For posterior regions, there's no need to keep the scanner in every direction. Here's a tip. Use a simple bottle cap opening motion to easily access those harder to reach areas. Once I have all the information I need, I can finish scanning by clicking Finish.
You have now seen how to take a treatment scan with Primescan 2. In the next video, I will show you how to create a lab order in the score.